I understand the want and need of a lot of people that want universal health care. I understand why your brain thinks that way, and that's fine. But when you actually sit down and work through it, you'll understand that it is not going to work for the United States. It's not. And let me give you a few reasons why. One, we are the largest. We're huge. There's millions of us. We're just too big. And we're too sick. Why are we so sick? The government. The government makes you sick. And the government is also the reason why we will never actually have any kind of healthcare system that will actually benefit the American people as a whole. Because in order to have healthcare reform, you need to have congressional reform. You need to have lobbying reform. You need to have term limits. You need to have campaign finance reform. All of these reforms are necessary before you can even start to think about having healthcare reform because all of your politicians' pockets are lined with big pharma and big healthcare money. The left and the right take it. The right gets a bigger portion usually. This past election cycle, though, Kamala did get more money from them than Trump did. So it's not one against the other. It's not one better than the other. It's all of them. It's us against them. So until you, as a regular Joe Schmo American, are ready to run for office and say, I'm going to put in term limits and I'm not going to take money from big pharma or big healthcare and I'm going to make these changes, until the American people stand up and stop being lazy and are willing to go through the trenches of running for office and making change, this is what we will have. This is the healthcare system you're going to have. So no, you will not have universal healthcare in your lifetime. You won't. It's not going to work. It wouldn't work. It's not going to work with the way things are now, and that's just a fact. I have worked, in insurance for a while. I've had to work with Medicaid and Medicare, and let me tell you, the government runs Medicaid and Medicare, and they run those two things horribly. It's very wasteful. There's a lot of fraud that doesn't get caught, and it's very corrupt. Um, but it is very wasteful. Have you ever, if you can name me like one government program that's ever really worked the way it's supposed to in an efficient manner with our tax dollars, please let me know. You can drop that down there. I'd like to look into it. But yeah, if the way it's working now is that's who you want running the entire country's healthcare system, the people that take from Social Security. You have to look at the big picture. It's good to want things. It is, but change has to be made. So if you're elected official, you can go right on the FCC website, and if your elected official takes big pharma and big healthcare money, don't vote for them. Don't, and let them know why. Give them a call. Be like, if I find out you're taking money from big pharma and healthcare, I will not vote for you. And that's where it starts. But otherwise, no, you're not going to see any real reform in healthcare in our lifetime.